Hello again, this is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today what I want to talk about is sleep apnea. Now I'm an upper cervical chiropractor and we're going to talk about sleep apnea, and some of you may be thinking, well, what the heck does sleep apnea have to do with chiropractic? Well, in some cases it has a lot to do with chiropractic. Now first risk factor for apnea is being overweight. Is probably the single biggest risk factor why people have sleep apnea, and in those cases that is not related to upper cervical spine injury. What is related to upper cervical spine injury in a percentage of sleep apnea cases is the soft palate. So for those of you know, if you open your mouth like you're trying to see if you have a sore throat, you've seen that uvula, it's called the uvula, hanging down in the back of the throat, or epiglottis. That's your soft palate. And the soft palate is muscles. Your hard palate is bone. That soft palate, whether those muscles are their normal tone or they've lost their tone or they're hypertonic, is all controlled in the brainstem and the central nervous system. So some cases who have sleep apnea, they have had an upper cervical spine injury. The tone of the muscles in the soft palate isn't the way that it should be, and when they fall asleep, instead of the soft palate staying where it should be, it drops and can close the airway. Second thing that can be related to upper cervical spine injury. If you look at a normal spine, the neck should have a C shape like this. Many people, when they've had an upper cervical spine injury, the neck straightens. When the neck straightens, that changes the airway, it changes the soft palate configuration, and a straight neck in combination with abnormal tone to the soft palate can make someone susceptible to sleep apnea. Now in other cases, it can be all three of these things together. They could be overweight, but if they were in alignment and they had normal tone, they may not have sleep apnea. And losing weight in combination with getting their upper cervical spine corrected oftentimes can make a big difference in their sleep pattern. So if you're someone who has sleep apnea and you don't fit that profile of being overweight, it very well may be that you've had an upper cervical spine injury in the past, whether it was a whiplash injury, a sports injury, a slip and fall, where that top vertebra under the neck, it's called the atlas, it weighs 2 ounces. This guy right here, head weighs 10 to 12 pounds, top vertebra 2 ounces. If you've had an upper cervical spine injury, that vertebra can shift and lock, and like I was talking about, it can flatten the cervical curve, it can irritate the central nervous system, decrease normal tone to the soft palate, and set things up to where you can be susceptible to sleep apnea. So if you're someone who has tried everything, nothing has worked to this point, it might behoove you to look into the upper cervical work. Our office does offer a free consult. We have 2 offices in the Los Angeles area. Our Los Angeles office is 213-399-7772, and our Carson office number is 310-324-6172. If you're outside the Los Angeles area, you've come across this video and you've tried everything and nothing's worked, and this has caught your attention, we'd be happy to find you someone in your location. Just give one of our offices a call. Our front desk would be happy to find an upper cervical doc in your area. So hope this information was educational. I know that this line of reasoning is not mainstream, and so I'm happy to make a video to disseminate the information that maybe hopefully will help someone live a better quality of life. Thank you.